Hi everybody, Dr. Amy Kanata here. Today I'm going to be talking to those chiropractors out there that want to increase their MD referrals and strengthen and solidify their referring relationships with medical doctors, and be sharing with you my top 3 tips on how to do that and what to do. Just to give you a little background, for the last 4 years, I've been working as a consulting physician for a group of surgeons, orthopedic and neurosurgeons, and helping determine if patients are surgical or not surgical. So I've done a lot of work with MDs, especially surgeons, in the last 4+ years of my career. With that being said, I want to share with you the top 3 things as a chiropractor you need to know in order to help you gain the respect of the medical community and help increase and solidify that relationship with medical doctors. In order to do that, I would recommend getting there's an article called Best Practices for Chiropractic Management of Patients with Chronic Musculoskeletal Pain. It's a clinical practice guide. It's written by Cheryl Hawk and Company. It was published in October of 2020. It's a great guideline on treating the most common top 5 musculoskeletal conditions, including hip, knee, shoulder, spine, and headaches. It goes through imaging guidelines, when to order imaging, what to order, and what the best evidence-based guidelines are. So that's just another little tip. But the top 3 things every chiropractor should know about working with surgeons and medical doctors is knowing when to refer out. And I would refer to that guide, get that guide, download it, look at it, read it over and over again, get yourself familiar with when is the evidence-based protocols appropriate to refer out. It's in that article talks a lot in detail about chronic, how long it's been going on, exacerbations, and how severe the exacerbation is. And I won't get into all that in this video, but it's a really great reference for you all practicing chiropractors out there. Number 2 is know what imaging to order for which body part you are referring to the medical doctor or orthopedic surgeon or neurosurgeon for. So know what to order know when to order, standing AP pelvis, and when to order, the Gracie view of the shoulder, like when to know what imaging to order, that the medical doctors and the surgeons are going to want to see. And if you don't know, you can always call their office and ask them. I always refer to that and say, would you guys rather order your own imaging, or do you want me to order it so that you have it when the patient comes in? The office staff loves that, and the medical doctors love that too. Number 3 is write notes or write your referral in a language that the medical doctors understand. So don't use chiro speak, like there was a listing at T12 and it was rotated left and I want you to see the XYZ. They don't understand that. They haven't learned what we've learned. But what they do understand is there's a lumbar radiculopathy at L4. They have weakness when they walk on their toes. Like, they understand that. Or I think it's an L5, or whatever you think it is, what your working diagnosis is. And then make sure to include the proper imaging if that is appropriate. So I hope you found this video helpful. If you did, feel free to like it, comment on it, and if you have any questions, feel free to message me. I would be happy to answer your questions, and if you can't find the guide, I'm happy to also write that in the comments, so you can get that guide and get that and help you increase your and solidify and strengthen your relationships with your medical doctors. So I hope that was helpful, chiropractors, and I will come back at you soon.